Hello, and thank you for joining us tonight for our free webinar, Computer Overuse Syndrome, Ergonomics for Neck and Shoulder Pain, featuring Dr. Rekha Lund. My name is Jeff Bloom, Education Marketing Manager here at L.A.C. OMS. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned educators and practitioners. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please use the Questions tab to assure that we see it at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand. And you may always use or visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture to Chinese herbs to practice management, you'll find something interesting for every practitioner on the L.A.C. OMS blog. Now for our featured speaker. I'm proud to introduce Dr. Rekha Lund. Her passion for natural healing paved the way to her unique educational background, combining Western medical expertise in physical therapy and Eastern herbal medicine and acupuncture. Dr. Lund utilizes nutrition, emotional well-being, sleep, and exercise as the foundations for optimal health. She strives to treat not only the symptoms, but also the source of the ailment. She completed her undergraduate studies at UC Irvine and earned her master's degree in physical therapy from Chapman University. Dr. Lund has over 20 years of experience as a physical therapist, specializing in orthopedics and geriatrics. She graduated summa cum laude from her master's degree in acupuncture and TCM from Emperor's College in Santa Monica and earned her doctoral degree from the Oregon College of Oriental Medicine in Portland. She is nationally board certified as an NCCAOM diplomate, and she is the co-author of the textbook Traditional Chinese Medicine, which is an international collaboration of Chinese medicine experts from both China and the West, covering the theory and practice of Chinese internal medicine in greater depth than any English language textbook available today. Please join me in welcoming Dr. Lund.
Thank you so much. Thank you for that lovely intro, Jeff. I really appreciate it. So nice to see all of you. Seeing all of you in the chat from all over the United States. So excited to be here today. So thank you so much for that lovely welcome. So welcome, everybody. Today, I'm going to be talking about computer overuse syndrome, ergonomics for neck and shoulder pain. And one of the ways that this idea came to my mind is because I'm seeing it so often in my clinic. Especially during this last year, I would say probably since March, April, people started shifting from the office setting to a home setting. And, they were just creating all these different types of contraptions and maybe working from their bed and doing all sorts of crazy things. And so just started to see a little bit of a change in the types of problems I was seeing as far as neck and shoulder pain goes, and including back pain, wrist pain, and hand pain as well. Today, we're going to mostly be focusing on the neck because it's such a big topic, and just want to go into a little bit more detail on that particular issue. Surprisingly, computer overuse syndrome, that particular term, is not in the literature. And so I was a little bit surprised to see that it's not in the literature. We have things that are kind of similar, like carpal tunnel syndrome, repetitive use injuries, and things like that, but nothing really relating to the specific use of the computer, and definitely not overuse of the computer. So we'll go into a little bit more detail about that and how that term came about. And it really is just the things that I've been seeing clinically quite commonly, and definitely more so this year. So some of the goals for today for you would be a way to quickly recognize some common faulty postures. And a lot of the recommendations that I give are things that you can do really quickly in the clinic, because I know that often we're focused on acupuncture and perhaps massage. Maybe we're working from home. So there's a lot of variety going on as far as, how acupuncturists are practicing during this pandemic. But if you are in the clinic, then, your time is taken up by these other hands-on treatments. And so I just want to give you some really quick ways to recognize some of these issues. And then the next next goal would be to teach you how you can teach your patients or even yourself 1 minute ergonomics. And I timed it because when I'm with a patient, my time's always very limited. And so I'm always trying to get in something that they can take with them, because I know that they're generally coming in for acupuncture and or physical therapy. But I want them to leave with something. And I think we all do that when we educate our patients. We get a higher level of improvement. The patient is more engaged. And then also for us as clinicians, we're giving some of the responsibility to the patient. And that is really important because, some people will come in once a week, once every other week. Some people come in more often. But the more that we can educate them and teach them, then hopefully they will have more to do in between visits. And then our treatment becomes that much more effective. So we'll be talking about specific exercises that they can take with them. We will try to get to exercises today. We may not get time today at the end, but I'm going to be showing you the importance of certain types of exercises, and in particular, why stretching often doesn't help these kinds of issues. So just to get to know you a little bit better, because I can't see you, I would like to know a little bit more about you, because the better we take care of ourselves, the more able we are to better take care of our patients. And so if you could just put in the chat really briefly, how many hours per day do you spend on any device? That includes your computer, that includes the phone, any kind of electronic device. How many hours a day do you spend on any device? Okay, so I'm seeing a 12. Wow. Okay, threes, lots of threes, about 2, 3, 4, 10, 8s, 5s. Thank you so much for your feedback. It's really helpful to see that even amongst ourselves, we're up there. We're up there, I think, with the average person, whoever that is now. So I'm seeing a range from about 3 to 12. So thanks for your feedback on that. And so it's really helpful to know, because we deal with these same issues as do our patients. So we need to also take care of ourselves so that we don't break down as we're trying to help everybody else. And then so the next question would be, do you have neck or back pain? So yes, lots of yeses. Okay, lots of yeses. I got an oh yes. For sure. Okay, so getting a lot of yeses. I'm getting a couple of no's, but mostly yeses. So very helpful to see that feedback too. So thanks for that. So again, I think we reflect our patients. And yes, we're doing this to educate ourselves so we can better take care of our patients. But this is, again, also for us as well, so that we can be, of course, healthier. If we're in pain, then it's hard for us to deliver good care, and also to serve as an example for our patients as well. And so now just your best guess, what percentage of people in the United States have neck pain at this very moment? Just take a guess as far as percentage goes in the United States. So I'm seeing 70s, 80s, 100%. Okay, so it's pretty high. Yeah, so you've got some pretty good guesses there. So generally at any given time, and again, depends on where you look and which studies you look at, the ranges I generally find are from 30 to 80%. And, at any given moment, generally hovers around 30%. But that doesn't capture everybody, because a lot of people have neck pain and then it gets better and then it comes back again. So if you ask them on a good day, it's like, no, my neck's not bothering me. If you ask them on a bad day, the answer is yes. So it does range quite a bit. What I want to capture today are the people who have neck pain and then they have neck pain again, because they get better with our treatment typically, acupuncture, massage, education, herbal medicine, all the amazing things that we do. And then there's a lot of people who have a recurrence. So on average, people who have neck pain often have a recurrence. So about half to 70% of those people that have neck pain have a recurrence of neck pain and or chronic pain. So it's a very, very common issue. And we are in a perfect position to help these people. As you know, I'm also a physical therapist. And so teaching people correct posture, exercises, all of those things that come under the realm of physical therapy is all great. But there's a big piece missing, and that's the acupuncture element when we talk about stagnation, circulation, and also the person's overall health. So that's something that we'll discuss in a little bit as well. I think those things make a person much more likely to have neck pain. So definitely something to consider in a comprehensive manner. Posture, specifically, we use this word a lot. And what really is it? What is really the definition? So it's how we position ourselves in relationship to our space. So if we're sitting on the ground like this woman is, so she's just relating to her environment, which is the floor, and then she's also doing some work on the computer. So this is just how she's positioning herself in relationship to her space. If we're going to sleep, that's our posture in relationship to wherever we're sleeping. And right now, most of us are sitting somewhere, maybe on the floor, maybe on a bed, maybe at a desk. So just in regard to how we position ourselves. The key point today is that any position, other than, of course, completely asleep, requires constant muscle activity. So keep this in mind, because it's a really important balance between certain muscles. And in order to be able to have good posture, we need to be able to use those muscles efficiently for a long period of time. Remember, I got numbers from 3 hours all the way up to 12 hours. So those muscles that are constantly working need to be able to function well for that number of hours. That's really difficult to do. Our bodies are not really designed to sit for that long. And so how can we overcome this physical challenge of needing to sit for so long? How are we going to do that? And the thing I always tell my patients is our exercises need to be harder than our life. So if we're sitting for 12 hours, our exercise should be able to surpass that demand. Otherwise, our exercise is not really serving us completely. Posture is accomplished by coordination of various muscles. So we need to have a good balance of these muscles and ensuring that we are as symmetrical as can be. Right versus left, front versus back. And I'll try to keep it relatively straightforward and simple today. And for more detail, I'm going to be having a class on more detail in regard to this. So all of us know these muscles, some of us very recently, some of us way back when. But, simply put, the trapezius was one of the main muscles we'll be focusing on, in particular, the upper trapezius and the lower trapezius. So the upper trapezius generally is designed as an endurance muscle. It can lift weight, but it generally shouldn't, especially if we're requiring work from our shoulders and our upper body to sit and type, use the mouse and things like that. And then we're having to hold up our head. So I prefer to leave the upper trapezius out of the exercise program because it's already being used so much, and focusing on the lower trapezius, depressing the shoulder blades is really key. And another piece of information that's really, really key in our exercise program is being able to externally rotate the shoulders. Those two muscles and those two functions are really important for being able to sit at a computer and sit at a computer well. And then deep to the trapezius and the rhomboids, let's not forget about these muscles. And these are also particularly important when we talk about the suboccipital region, in particular the rectus capitis, posterior minor, posterior major, and then the obliquus capitis superior and inferior. Those in particular are often burdened with the weight of our head. So anytime our head comes even slightly forward, I see a lot of people who have pretty good posture. Pretty good is often not good enough anymore, especially if it's a person who's sitting for, I would say, about 4 or more hours a day, just to put a general number on it. If they're sitting for that period of time and their head is slightly forward, those muscles cannot handle that load, because most people's head weighs about 10-ish pounds or so, and those muscles get exhausted. They typically will go into a hypertonic state, and this can definitely trigger headaches, neck pain, shoulder pain, and so on. So very, very important to recognize the load on those muscles. And when I say load, I'm talking about the amount of weight and the time. So we have to consider the time as well, because sometimes there's very little weight if somebody's head is slightly forward, but then if we multiply it by 10 hours, then it really adds up significantly. And then not only in the course of a day, but in the course of a week and a month and a year and so on. So let's consider all of those factors when we consider the level of demand on these muscles. And equally important, and I do say equally because often when people come in with neck pain, I don't start with the abdominal area, but I will teach them eventually, maybe in visit number 3 or 4, depends on the rapport and how receptive they are. But eventually we'll go to the abdominal area, because if this area is weak, this will leave the person with a typically either anterior pelvic tilt or posterior pelvic tilt in an excessive direction. Can be an issue. Some people will have what we call compression syndrome, and that's just from too much sitting, period. And the transversus abdominis is one of the few muscles that can actually provide us with some traction. And if we can get traction from the lower spine, that will also help support our upper body posture, our neck alignment, our shoulder position. So I'll teach people these muscles are the foundation for your shoulders and your neck. And yes, I understand that it's your neck that's your main problem, but we need to work on your foundation as well. And most people, by several visits into it, they do understand that we need to work on the foundation. And then just another example of some of the deeper muscles here. So one of the muscles I wanted to show you here is the multifidus, and we have multifidus in our lumbar spine, our thoracic spine, and our cervical spine. So very important to consider all of those, because it is one of the main muscles that gives our spine stability. It's a very deep muscle. Often I see in most people's exercise programs, they're focusing on their rhomboids, their trapezius, their abdominal muscles perhaps, and so on. They're big muscles that they see, but they don't necessarily consider the multifidus. And that's a very, very important muscle to address, because that's our foundational stability of our spine. And here's the cross section here where you can see exactly how it relates to transversus abdominis. Those two muscles together, multifidus and transversus abdominis, work together to create spinal stability and traction. So we need to consider traction because we're talking about sitting. So traction is really key to offset the demand of that many hours of sitting. What is computer overuse syndrome? And so this is something that I defined because it's something that I see clinically, and this is not in the literature anywhere. And so it's something that really I came up with based on what I've seen clinically for many years, but especially more recently considering the pandemic. It's any combination of neck, shoulder, back, arm, wrist, or hand pain. This would also include numbness and tingling, headaches, and or eye strain due to overuse of the computer and or phone. The next section there, often but not always. So just because somebody sits with poor posture does not mean that they're going to get neck pain. And the converse is true as well. Just because somebody sits with good posture doesn't mean they won't have neck pain. So there's many other factors at play here, but definitely the overuse of a device can trigger somebody who is susceptible to this kind of strain. The other thing I want to address is that, and I do see this quite often as well, generally it happens with time and with age, not age in and of itself, because the younger generation has grown up with devices. And so I'll see people in their early 20s, even 25, that age range, and they are now dealing with some permanent changes. So over time, if the posture and the alignment is not corrected, if that person doesn't correct their body mechanics, then they are very susceptible to permanent change in tissue integrity, bony alignment, muscle length, nerve conduction, nerve glide, and muscle strength. So these are the people that we can capture. Again, we're in a very good position to capture these people before they get to this point in their life. And if we can intervene early, then that would be ideal so that they don't end up with a permanent change. And when I say permanent, I mean that when they move, if somebody flexes their neck, for example, they don't flex at certain joints. If they rotate their neck, they don't rotate at certain joints. So they have actually lost mobility. A lot of people slouch, but they're able to correct their position. When somebody has a permanent change, I should say temporarily permanent because it is changeable. But when I say permanent, I mean that they are walking around in this position all the time. So even when you try to correct their position, they simply cannot. They don't have the mobility to do it. They don't have the strength to do it. They don't have the mobility to do it. With our intervention, they can make a change. There's a woman I'm working with right now. She's 86 and super active, and she's been dealing with some of these permanent changes. So I've worked with her for about 2 years, and I can tell you very happily that she has actually made improvements in these so-called permanent changes in bony structure. So it is possible. It takes time, but it is possible. The less time somebody's been in these positions, the easier it is to change, of course. I don't often use age in my conversation with patients because I don't find it to be always relevant. I have people in their 40s who are really stuck, and I have people in their 70s who are not. So it's not just age, and people don't generally like to hear about age. So I don't usually use that word. I'll usually say, you know, how long have you been doing this kind of work? Like, how long have you been at a desk? And, you know, they'll tell me, well, I've been doing this kind of work for whatever it is, 20 years. Okay, so that gives me a little bit more insight as to what their lifestyle is like, what is the demand on their neck muscles, their shoulder muscles, how compressed is this person? And then some people, they were perhaps in an office environment, maybe they're in a clinical setting like us, and then now they're perhaps seeing people on Zoom. I have some Pilates teachers that I work with, and now they are no longer in the Pilates studio, but they're teaching on Zoom. So that's a great example of somebody who went from completely in person, active, on their feet all day, to now all of a sudden sitting all day. So that's a really great example of a sudden change. And so just a quick check-in. What's your posture like right now? Want to make sure your feet are flat on the floor. And I prefer to have hips slightly higher than knees. I know in a lot of teachings that often it's taught that hips are at knee level, but I really prefer to have the hips slightly higher than the knees, and we'll talk about that in a little bit more detail in just a bit. And are your ears over your shoulders? So if you're tending to bring your head forward, please bring your head straight back so your ears are over your shoulders. And so for many people, this does feel unnatural, but I also make the point that sitting all day is unnatural. So we have to work a little bit harder to offset these demands on our body. Poor posture causes more than just pain. So I think we know this, but there are some studies showing that when people sit in a good position, they actually perform better on a test. And when we don't sit up well, this can lead to lack of ability to concentrate, fatigue for sure. Of course, we start breathing more shallowly. We have decreased respiratory volume. For some people, it does lend to anxiety and stress. And when we sit up straight, it does improve our outlook. We tend to be more positive. We tend to have better energy. There's many studies actually that I came across showing improved circulation because the heart can be more open. I mean, we talk about that in acupuncture for sure, but also physically as well, energetically and physically, and improved memory. And this has been supported with studies with different types of testing. So this term is in the literature. It's called text neck, and it is specifically related to phone use. I think we're all fairly guilty of this at this point in our lives and in our world. But just look where their necks are positioned, and everybody has their head down. And this is a very, very common issue for many people. So if you are doing this, please try to find a way to get your head back so you can keep your face vertical and your ears over your shoulders. That's really important. This is a pretty good example. She is in a good posture overall, for the most part. You know, it depends on how long she's going to be in this position. So as I mentioned earlier, time is really important, because if she's going to be in this position for 10 hours, I would definitely intervene and give her some suggestions. If she's here for a quick email or two and then she's going back to do something else, probably not a huge deal. There's definitely some improvements that could be made here. So she is, I would still consider her to have a forward head posture. It's not terrible, but it is high considering that if she's going to be here for hours. So I would have her bring her head back. She does need to raise her screen, and it looks like she's probably on a laptop. So if she's on a laptop, I would recommend having an external keyboard, and you can find a pretty good one for about $30 or so. So it's a very good, worthwhile investment. And then we can definitely raise her computer higher so that she can look straight ahead. Right now you can see she's looking down. So she should be looking generally straight ahead would be ideal. And then I would try to bring her elbows back a little bit so that her elbows could be closer to being under her shoulder. It doesn't have to be totally under the shoulder, but at least closer to coming back, because that will allow her to pull her shoulders back. It'll allow her to pull her shoulders outward a little bit. So that external rotation of the shoulders is really important as well. And one thing to keep in mind, and this is kind of an interesting thing to say because I'm teaching this class here on computer overuse, but there is no one perfect posture. Different things work for different people. It really depends on many factors. Some people's shoulders are broader than others. Some people's demand is different, in terms of how much they're typing. Are they sitting at the computer like we are now and we're not really typing, we're just looking and listening? So that would be a different type of setup for sure. So it depends on many of factors. This is a good example of somebody with broader shoulders. So you can see how his hands are positioned inward to reach his keyboard, and his elbows are quite wide, and that's just because his shoulders are broader. He is in a forward head posture as well. So this is somebody that could benefit from an external keyboard as well. And I would have him get a keyboard that can be split, so that way he can position his hands wider. And it looks like he's maybe at a coffee shop or something like that, but now he's probably working from home as well. But if we could, definitely we would need to raise his computer screen for sure so that he could also look at eye level. That's something to look for. And we'll go through a sequence of how to address this with your patients and with you as well. We talked earlier about the position of the neck. So the lower the neck, the increased amount of cervical flexion increases the amount of weight on those small muscles we were talking about earlier. So all those suboccipital muscles, the upper trapezius, and even all those muscles down below are working really hard to support the weight of the head. They're basically holding the head on. And so the lower the neck, and the lower the head, then the more demand there is on those muscles. So if somebody's texting for a moment, like the first person here, notice how they brought the phone up and they have their head in neutral. Not a big deal, maybe some stress on the hands and the wrist and so on, but then they're putting their phone away and then they're done. Then you have the next person on position 2, really a pretty good position overall. And they've only tilted about 15 degrees, which is not a lot, but already they're at 27 pounds of demand on those little muscles. Now, if you're on your phone for many hours a day, which a lot of people are, especially if you're reading, please be sure to bring your head up to neutral. It's really best not to read on your phone because it is small and it does lend itself to this kind of positioning. So if you are going to read electronically, it's best to read on a bigger screen if possible, and definitely get out of these positions that you're seeing here. And I do see a lot of people at the 60-degree mark and they don't even realize they're doing it. And this is the problem, in that people don't even know they're doing it. If they knew this, they wouldn't do it. So what I see often is people will come into the clinic and then, not nowadays, but when we had a waiting room, they would wait in the waiting room and then they would come in, but I would peek out and just see what their habits are. And often they would be sitting there in the waiting room with their head down, texting or reading or something like that. So I may not bring it up right away, but during our treatment course and as I get to know them, I'll call them out on it in a nice way. It's like, oh, I noticed that you were sitting and you generally tend to have your head down. And so really important to be mindful of that really throughout the day. And there's many techniques to remind somebody when they get into these kinds of positions. I use kinesio tape quite often, and it's just a very gentle reminder like, hey, you're going into this position again. And you'll do that for maybe 1 or 2 days, and people will realize how often they're going into these positions. And that usually will be enough to break a habit for a lot of people, but it often takes a lot more work than that. So this is not necessarily a weakness issue, right? It's not a flexibility issue. This is just a bad habit issue. So habits are really important because we could strengthen these people. I noticed some people in the chat are talking about a good work setup. They're doing Pilates regularly, exercising regularly, and that's great. But it won't necessarily correct these kinds of habits. So some people are working out often, and that really helps their internal circulation, their internal health, their inflammation levels, and things like that. But we also need to address the habits as well. So here's another good example of what a lot of people do. And, you know, obviously his computer screen is too low for him. He could maybe raise his chair a little bit, but then he would also need to raise the height of the laptop. I mean, he's just in a bad position. I mean, he's got his lower back flex, which is not great for the discs. Again, depending on how long he's there, if he's there for say an hour or so, he's going to probably have low back pain and shoulder pain and neck pain, and maybe even a headache and eye strain. So he's got really all these issues going on. His hips to me look a little bit low. Often it is taught to have the hips at 90 degrees, and you'll see that in most literature and even some educational materials, to position the hips at knee height. I think for most people, it doesn't work. And like I said earlier, it's not one position doesn't work for everybody. So depending on what their problem is and what their work setup is like, sometimes we'll have to compromise a bit and choose one thing over the other. And so for him, you know, if we raise his screen, then, you know, we may need to somehow compromise. It depends on what his problem is. If his main problem is neck pain and not low back pain, I may want to focus on the neck and bring in the lower back positioning a little bit later. If we can do both at the same time, that would be great. But it depends on what the person has access to. When people are working in an office, sometimes they'll have that kind of support. They may have an ergonomic team that can help them. They may have funds to get a chair. They may have an adjustable desk and things like that. So working from home, some people don't have those resources. And so we are often trying to create things to allow them to position themselves better. Some people have like a savings account to purchase a new chair, but perhaps they haven't gotten a new chair yet. So I'll take towels and roll them up and tape them, and so they can sit on those to raise their seat a bit. We'll put yoga blocks under the computer. I mean, there's many different things we can do. I would say the most worthwhile and least costly intervention would be to have an external keyboard. If someone's working on a laptop, I would say that external keyboard can give us a lot more freedom. Working on a laptop comes with many challenges just because we're kind of stuck and we can't really adjust the screen height and the keyboard height at the same time. Most people need their screen higher, but then the keyboard's too high. So that's where that extra keyboard can come in really handy, and it's not that costly to do that. So I think it's a great, worthwhile investment. And here's another really funny example, to me funny because she's got these heels on, and so she's pretty in a similar position to the previous person, but with the heels, I mean, I'm saying it's funny because she's got this great chair, you know, and I'm saying it's funny because she's got all these really great things set up, and then she's not utilizing it well. And in my experience with ergonomics, this is something really common. You know, I would work with people who had a $20 chair, and we got them into a really great setup with really very little money, and they did great. You know, they did really, really well. It really completely resolved their problem. And then you have someone like this who's got a really great chair and is not utilizing it well. It's not really taking advantage of what she has here. So her hip height looks good to me. Her hips are a little higher than her knees, which I tend to prefer for most people. Again, everyone's different, but for most people that tends to work better because when the pelvis is tilted a little bit with the hips a little higher, that typically will lend itself to a better upright posture, better shoulder positioning, better neck position. So having that foundational position at the pelvis often will allow for better posture in the upper spine. Not always, but that does seem to work for most people. I would say, you know, maybe 90% of people. So that part looks pretty good. I would definitely have her take her shoes off while she's working because having her feet in this position, she's just lost a significant amount of weight-bearing area. So it's really not great that she's got these heels on because now all her weight is anterior. She's on her toes and her weight is being shifted forward. And with that forward weight shift, that forward momentum, it's, I think, lending itself for her leaning forward. Her keyboard is way too high. You can see her elbow position is like up on the desk. So for her, we would correct her posture. It looks like it's maybe just a habit. So correcting her posture by bringing her shoulders back, getting her shoulders over her hips, and getting her ears over her shoulders. And for her, I would somehow create something where she can have her keyboard lower. Her screen height looks pretty good. So as you can see, with everybody, there's certain things that are really good and then some things that we need to work on. And for a lot of people, especially in our acupuncture arena, if we can correct one thing and really I think that can really, one thing can make a really big impact. And sometimes you're not going to capture all of these elements in an acupuncture session. People tend to come in, they want acupuncture. But, if somebody's coming with neck pain and we can give them a tool to take home and it helps them, now you've got this patient who has now given you their trust and they're coming back for another visit and another visit and another visit, because each time you see them, you're giving them something new. I try to focus on one element and really just focus on that one thing, because as you know, when we give people too much information, it's just too much information. So I try to find the main thing that would help this person. So if this was a patient, I would just engage her to correct her posture. I wouldn't even really address the table height. It looks like she's got an adjustable table there. So there's a lot of things we could do with this. But I would start with number one, just having her align herself better and perhaps giving her some postural tape on her back just to create some new habits. And then on visit 2, we'll talk about the desk height and things like that. And disc height. I was going to say disc height because her disc height is going to be an issue, but desk height as well, because that can also help her to sit up straighter. And in the meantime, maybe we'll talk about getting an external keyboard. So that's a lot of information in one visit. So I would pick one of those things and try to have a big impact, especially on visit 1. There's a lot of other things going on. So maybe just one of those elements would be really helpful. Another good example of something that I think I see really often, I'm sure some of us are doing this today, not now, because I think I see a lot of people correcting their posture now. But one thing we didn't talk about yet is the kyphosis, the thoracic kyphosis. So the correct way to talk about thoracic kyphosis, it's natural and normal to have a thoracic kyphosis. That is our natural position of our spine. And when I say increased means it's like a hyperkyphosis, like it's beyond what's considered normal. So the technical way to say it would be increased thoracic kyphosis. She's definitely got a forward head. And the way that's measured in a gross way would be how far her ear is from her shoulder. So she's, I don't know how far that is, probably 8 inches or so, really far out. There's 2 major issues there. The other thing she's doing is she's got her face out here, but then she's having to extend her upper cervical spine. And that is a perfect position to trigger a headache and strain on those suboccipital muscles. So this is definitely a good candidate for, typically people don't generally get mid-back pain. Sometimes they'll have some fatigue there. But often her neck is doing all of this work for how many hours a day, we don't know. But that upper cervical spine is vulnerable because, as you saw earlier, those neck muscles are really tiny. And so they're not designed to extend the neck. They are postural muscles, so they're designed to sustain a position. They're not really designed to extend the neck, definitely not for an extended period of time. This is somebody who's in a pretty good upper body position. Her neck and shoulder position is pretty good. Her screen height could be a little bit higher, but overall, I would say it's acceptable. But you could see how she's slipped her lower body forward in the chair a little bit. So if she were to bring her hips back, that could help quite a bit. Now, it depends on why she's doing this. If this is someone I was working with and she started off her morning sitting back in her chair, and now she's just briefly going into this position to give her spine a little bit of a different position, a little bit of a rest from being in either neutral or anterior pelvic tilt. This could be an acceptable position for several minutes, maybe even up to 10 minutes. Because for some people, I do have them change positions in their chair throughout the day. So sometimes I may have them go into this position briefly, then go back to sitting back in the chair. And that in and of itself, that moving around can be very, very helpful. Ideally, they're just getting up. They're going from sitting to standing, taking a brief walk. Moving around is really vital for this kind of work setup. just to decompress the spine. So this is my quick and easy 1-minute ergonomics. As you know, this is much more complicated than this, but this is something that you can go to pretty quickly with your patients. And as I was saying earlier, depending on their setup, maybe you go to one of these things on that first visit and just tell them, you know what, just get your feet on the ground. I see some people who perhaps have their feet, like they're on their tiptoes, maybe just out of habit, or they're resting their feet. Like that first example, the person with their feet flat, they rest their feet on the bars of their stool. They are maybe crossing their legs, anything like that. So just feet flat on the ground can be very, very helpful to just start from the ground up and create that stability from the bottom up. Then in the second picture in the middle there, the hips are slightly higher than the knees again. Again, that doesn't work for everybody, but for most people, it tends to get them a little bit more upright. If their seat height is not adjustable, I will put a small roll of it. I'll roll up a towel and perhaps fold it or tape it even, and I'll have them sit on it. So it'll go in the back of their chair and they can sit on it. And then that will, in effect, raise their hips a little bit higher. And often they find that it's less energy to sit upright when they have their hips higher. Maybe that person needs to lower for part of the day and go higher for part of the day. It really depends on what you're seeing and what their symptoms are, but that does work for a lot of people. And then we talked about ears over shoulders. He's looking pretty good there. You can see his elbow position on the right arm. His elbow, you can't really see it's behind him, but you can see that he's got his elbow mostly under the shoulder. He does have some thoracic kyphosis that is developing, I would say, and can very likely be corrected. But overall, considering where he is and how he's set up, I think overall a pretty good position. And then for the next position there, the elbow bent, this is quite variable as well. And that's why I said approximately 90 degrees. It really depends on what the person has available. It doesn't always have to be exactly 90. If somebody can lower their keyboard, I prefer to have their elbow flex a little bit less. So that would be, in this example here, I would have her hand even a little bit lower. But again, 90 degrees works for most people. And for something quick and easy like this, then I would say it would capture most people, but generally never higher than this, because when the elbow's bent more than 90 degrees, typically we have to drop the hand, drop the wrist, and then that can lead to wrist and hand problems as well. So generally this works for most people, either at 90 or a little bit lower than 90 is where I try to get them. If I have the flexibility to adjust the height of their keyboard, that would be ideal. And then the wrist in neutral position. So this last picture here, having the wrist neutral, so the wrist is not flexed, it's not extended, and we generally don't want the wrist resting on something, especially not on something firm. For some people, they need that extra support. But for most people, I'm trying to build up their strength in their forearm and in their wrist and in their shoulder. So some people with carpal tunnel syndrome, it's very similar to what I was saying earlier when we're talking about a neck problem and we want to work on the abdominal muscles. The same thing applies here. If somebody has a wrist or hand problem, we also need to work on their shoulder. Oftentimes getting their shoulder back can help the mobility of the nerve, the amount of stress on the nerve, and the amount of stress on the wrist. And of course, positioning is a factor as well. So stretching is interesting because many people come to me after seeing other practitioners because either they've gone to a physical therapist and they're coming in for acupuncture, or they want to do a combination of physical therapy and acupuncture. And so I'll go through, well, what have you learned at this point? You know, what have you been told to do? And so they'll do, you know, the neck stretches, the ear to shoulder type things, perhaps a levator stretch, things like that. But they're still having neck pain. And so there's often pieces that are missing in that either they don't have the strength, which is that next block there. Most people with neck pain do have significant weakness in their postural stabilizing muscles. And I do mean all of them. And that could be the deep neck flexors. That could be the neck extensors. It could be the upper back. It could be the suboccipital muscles. It could be the abdominal muscles. Lower trapezius is a really big one. That's a very common one where people overcompensate with their upper trapezius and they don't use their lower trapezius enough. They don't rotate their shoulders outwardly enough, and so they're not really using their teres minor and infraspinatus. Those are key factors as well. So it's not often enough to tell people, well, sit up straight and let's stretch your neck. So they often do need that strength as well. And not just strength, but also endurance. So I describe sitting as a marathon because, as most of you have mentioned, I saw anywhere from, 3-4 hours all the way up to 12 hours a day. And I would say on average, most people that are doing desk work are sitting, 6 to 8 hours a day. Teachers are another good example now because, they used to be in a classroom and moving around all day and, walking, et cetera. And now they're teaching online perhaps and sitting at a computer, 6 to 8 hours a day. So that's another group of people that have changed suddenly their work environment. Many of us as well. So that's another factor to consider. So I would say these are all equally important. Generally, I would say the strength is probably the biggest issue that I see most commonly, and oftentimes why stretching doesn't work, because most people don't have that much of a flexibility issue in their neck. I mean, even if they are tight, when people are tight, I often find that they're tight because they're weak. And so their neck is trying to hang on for dear life, and they're trying to fight for the stability of their neck that they just don't have the tools for. And so for many people, if we start off with strength, then the tightness often will correct itself when they have the stability and the balance and the symmetry of their muscles, anterior, posterior, left to right, shoulder external rotation. Those muscles are generally weaker than the internal rotators of the shoulders. When those are all balanced, most of those muscles can start to relax a bit. If they can start to work on strengthening their lower trapezius, often that will help reduce the tone in the upper trapezius. That in and of itself can reduce pain. So that's an exercise that I find to be really helpful to get people to reduce the tone of their upper trapezius because they're just using it so much. Sitting is a marathon. And so let's not forget that, because I think it's an endurance activity, just like we think about a marathon. You got to train for it. You got to prepare for it. You got to eat for it. You got to be at a certain level of your health, keep your inflammation low, all of those factors, your diet, all of those things come into play here. Because if somebody's eating poorly, they're in an inflamed state, they're much more likely to end up with a repetitive stress injury, just like this one is. So what is the solution? So we talked about strength, symmetry of muscle activity. So you could see that, with this person, he's able to extend his thoracic spine really well. And, even people who do yoga and Pilates quite regularly, I still see some of these people who are not symmetrical. And it is a process, it's not something that happens overnight. So somebody was writing in the chat to be patient. It is a patience, an issue of patience, because it happens very gradually, especially if this is new for you or new for one of the patients you're working with. It is something that does happen gradually over time. And so this is when, on visit 1, you get the commitment from your patient to have that conversation of the more the patient can give you in terms of their participation when they're not with you, then the better they're going to get over time and the less likely they are to have a recurrence of pain. And that's really where we want to be as clinicians. We really want to get our people better and keep them better. And happy patients will refer people. So there always used to be this fear of you're going to get your patient better so quickly that they don't need to come back anymore. And that may be true, but those people are so happy that they're going to keep referring. So that shouldn't be a fear. So we want symmetry of all of our muscles. As I mentioned, left and right. Some people are very one-sided dominant. They do the same activity on the same side all the time. So if possible, try to do things bilaterally. Some people always text with the same hand. Try to text with the other hand or do both hands. Same thing with typing. If you don't know how to type, learn how to type. That would be great. But You know, those kinds of things. Mouse is a really great example. It's really difficult to use the mouse with the non-dominant hand, but that's very difficult to learn. But if you can, that would be great. I think that's pretty difficult to ask of people. But if you're using the mouse, take a break from it. So you use the mouse, put your arm down, hang your arm down at your side, maybe stretch the wrist while you're perhaps reading something, or maybe you're on a live call with somebody. So that's a time to maybe do some wrist stretching. Decompression is coming from the transversus abdominis primarily, the multifidus as well, and get out of your seat, you know, stand up, move around. All of you are free to do that now if you like. I can't see you. So decompress your spine. And I would say a maximum of 30 minutes. So visit one could be something like get out of your chair every 30 minutes, set an alarm, do what you need to do to get out of your chair. Even if you need to stand up for 30 seconds, but just briefly decompress your spine. Better yet, if you can go to the bathroom, get some water, do a stretch, if you can do any of those things. There's some apps available. Thank you for that. So there's some apps available for that. You can set a timer, write yourself a note, do whatever you need to do. When I'm teaching a patient, I try to, if they're working from home, especially now, but even if they're not, if they can do one stretch every 30 minutes, 30 seconds on the right side, 30 seconds on the left side. That's their 1 minute break, and then they go back to work. So I give them maybe 10 to 20 exercises. They're not doing them all every day, but they'll do, let's say they're working 6 hours today. So on that 6-hour day, they're doing 6 of those exercises. But I didn't teach all those 6 exercises in one day. So I'll give them one exercise, and then they do that exercise until the next time I see them. Then we add a new one, and then we add another one, and so on. So we definitely want to get that decompression. There is no muscle that can counteract the act of sitting for 6 to 12 hours. It's just not possible. So the best thing to do is get out of your chair, move around a bit. If that's not possible, then just stand up. If you have a standing desk, great. If you don't, stand up for a minute and then sit back down again. Just decompress the spine whenever you can. And then endurance. So when we train, we want to train for strength, but we also want to train for endurance. So when I'm doing an exercise program with somebody, I might have them, depending on their work schedule, I might have them do 50 reps of a certain exercise. And that's a lot. We don't start there. We might start with 10, and then a week later we'll go to 20 and build up that way. Maybe they do 10 every hour. But definitely we want to work on endurance, not only with that particular muscle group, but also endurance as a whole. So I know we teach our patients to take care of themselves. This could be a walking program. This could be ride a bike. This could be something where they can build their overall stamina, cardiovascular wise. This is my pathway to improving computer overuse syndrome. So of course, on visit 1, we are looking for areas of weakness. We may not be able to do a full assessment on that day, but you can generally tell from the way they posture themselves, if they tend to slouch, if they're having a neck issue, and perhaps they present themselves to you and they're sitting up nice and straight because they're on their best behavior. But, you know, you can just ask them, you know, what are your habits like? Do you tend to slouch during the day? I would just ask them, because usually by the time they come to see us, and when they come to see us, they're usually doing their best. And so we're going to see them possibly sitting in a good position. So I would just ask them, you know, what are your habits? You know, when do you tend to get in trouble? Some people will tell me like, you know, I'm at my desk, my work desk all day. And then at night, I like to read on my phone. Or, you know, at night, I've got so much work to do. And so then I take my laptop to bed, and then they're working for 1 to 3 hours in bed. What's their lifestyle like? You know, are they working every day? Are they able to change things up? Are they online every day? Are they in the clinic sometimes and at home sometimes? You know, so just generally, what's their lifestyle like? Are they working 12-hour days? You know, I have some physician patients who are seeing people online, but sometimes they're in the office, so it changes. So I want to know all those details to learn what is their demand on these muscles. And so work position, we talked about their overall inflammatory state. This would be things like other medical conditions. You know, what is their diet like? What is their exercise like? What is their self-care habits like? What are they eating? Are they diabetic? Do they have elevated blood sugar, though they're not diabetic? Are they having a coffee and donuts for breakfast? You know, what are they doing in their life? What is their overall health like? And then their stress level, because stress level, I find, plays a big factor in their ability to take breaks. If they're really stressed out, it's like, I've got this assignment to do, I've got to get this project done, and I've got, 4 days of this, and it's just an amped up level of demand on that person for those 4 days. And then after those 4 days, I get a break. So I want to know that, because we do a little bit more in the background in preparation for a project like that. Some people have this kind of demand where they have a little bit of a lull, and then they'll have a really crazy week, and then a lull again, and then a busy week, and then a more relaxed week. So those people, I want to give them a little bit more to do when they're not stressed out. And then I'll try to give them a program that matches their lifestyle, so that they can see that, oh, this is doable, I can fit this in. And I'll ask them on day one, realistically, how much time do you have to exercise? Some people will tell me 2 minutes. And so, okay, 2 minutes. So I'll work with the 2 minutes. Okay, I'm like, in my head, I'm calculating, that's 4 exercises. I take 30 seconds or so for each exercise. That's 4 exercises per day. To me, that's pretty good. I mean, it's not a lot of time, but I can get a lot done in 4 minutes, 4 exercises. And once the person sees that, oh, she's working with my 2 minutes here, then they'll usually give me a little bit more time. Well, I can do a little bit more than that. So the way I'll give it to them is I'll tell them, well, here's program A, and that could be 1 or 2 exercises. And then I'll give them program B. And program B is, if you have time, then do program B. And if you don't worry about it, because I don't want to stress them out more. They're already stressed. They're dealing with this pain issue or a headache issue. I don't want to add more to their plate if they're already stressed out. So part of that goes into the education component of, we want to address their habits, like if they're on their computer in bed, they're watching TV in a bad position, they're on their phone at night, things like that, So it depends on what that person's personality is like. You don't want to do all of this in one day. Some people are very receptive to these things. Most people know better, but they do it anyway. So it's a very delicate conversation, in my opinion. You don't want to take away all of their comfort, especially right now. People are stressed from so many different, on so many different levels. So sometimes if it's not a big deal, I'll let them keep some of their bad habits, and I'll try to address 1 or 2 big ones. Most people will be willing to change one thing. And then this is the part I want to spend a little bit more time on, explaining the course of the treatment. Because, if you tell them, okay, we're going to do acupuncture or whatever it may be, perhaps massage, herbal medicine, whatever it is. I know we all do this. I just want to bring it up in regard to the exercise component. When people come in and they tell me they have 2 minutes a day, some people tell me they have an hour a day. Great. So even with those people that have an hour a day, I will explain to them, these are new things for you. So I don't want to give you 10 exercises today. You may leave here and you might feel fine while you're doing these exercises, but you may be sore later because we're using muscles that perhaps you haven't used in a long time. That's my nice way of saying that they're very weak. But I'll tell them that, there's some muscles you haven't used in a long time. And so we want to use them so we can create balance in your body. And so that's my nice way of telling them that some muscles are strong and some muscles are weak. I don't generally use that word weak, but I'll say you're not really using these muscles, and you should, because they're designed to help you. And so I'll say, I don't want to do all of those things on the first visit, because if you get significantly better, that's great. If you get sore, we won't know what made you sore. So let's do 1 thing today, maybe 2 things. And then let's see how you do with those things. And then we can build from there. I plan to give you 10 exercise programs. And some of them are like, whoa, that sounds like a lot. But we're going to do 1 program each time you come in. And we're going to build on it. We'll review what you did. We'll add to it. And so in the back of my mind, I'm thinking of how many visits it's going to take to get this person better. 10 just sounds like a nice round number. Usually it's more than 10, but you're saying 10 because it sounds reasonable. You can get the person significantly better, I think, in 10 visits. Likely you're going to need more. But if you can get this person, say, 40 to 50% better by visit 10, they're likely to keep coming to you. And so that's the conversation I'll have in the beginning. And I'll just tell them, I don't know how long it's going to take to get you better, but I expect you to get at least 30 to 50% better, if that's what I'm thinking, by such and such date. So then they're like, okay, it sounds reasonable. It's not reasonable to say we're going to do acupuncture 3 times and your pain should be gone. And of course that does happen. I know that happens to me. I'm sure it happens to you. That does happen. But the majority of people don't fall into that category, especially the people who do acupuncture. They feel better. They feel better for a couple of days, maybe even a week, and then their problem starts to come back again. So this is for those people where they have tools they can use, tools that you've taught them, and they can start to incorporate that into their life. As far as ergonomics goes, we looked at the 1-minute ergonomics, quick and easy, try to capture at least one of those elements. On the first visit, get the person to take a photo of their workspace, or even better yet, a video. If somebody else can do it for them, have them take a photo of how they look in their workspace. What is their setup like? Because then maybe you can look at it on visit number 2. You don't even have to bring it up on visit 1, but on visit 2, it's like, oh, it'd really help you if, and then whatever that would be. And then, try that when you get home or to work, and then a way to set those decompression reminders to get up at least every 30 minutes. Sleep position is a whole nother topic. Maybe we can do another talk about that at some point. I think that's a very important thing as well, especially when it comes to neck pain. I think there's 1,000 pillows out there at any given time. Many patients who've bought many, many pillows and none of them worked for them. So there's a lot of quick and easy things that we can do to align the person in their best position. And I say their best position because, again, there's not one best position, but to align them in that position to help them rest and heal, because we're healing at night. So the better our sleep position, the more comfortable we are, the less stress on our neck. Strength, we want to address the areas of weakness, of course. Again, if we can give them one exercise that will address one area of weakness and just give them that big bang kind of exercise, then maybe we can capture a lot of their problem in a very few simple tools. And one thing that we want to look for, and I'll get into this in a lot more detail in the class coming up on February 6th, is we want to really make sure that they're not compensating during their exercise. So most people are working from home now. They're not working with a trainer. They're not working with their Pilates teacher. They may not be working with their physical therapist, their chiropractor, and so on. And so a lot of people are now following videos. I see a lot of people hurt themselves doing these exercise videos online with really no guidance. I mean, they're just following a video. And I commend them first. Number one, I was like, great job for committing to continuing to exercise, because a lot of people have stopped exercising. So I always want to recognize the good things that they're doing. And so I'll commend them for exercising. And I'll say, show me some of your exercises. And I'll just look at what they're doing, because some people will demonstrate, I don't want to use the word, I was going to say kind of scary things, but they'll demonstrate these techniques and I'm like, oh no. In my mind, I'm saying, oh no. But outside, I'll tell them like, oh, it's really great that you're exercising. Let's review this one and we'll go over that particular exercise. And I never want to make them feel bad, because most people are really doing their best to take care of themselves the best possible way they can. So I try to emphasize the positive things they're doing, and then perhaps bring one thing up that can really help them that much more. And then measuring things can be very helpful, especially on visit 1, because that people will come back and complain, and it's like, well, my neck still hurts. And, if you have notes from visit 1 that, when you first came in, you were able to turn your neck to the right 60 degrees, for example, and you had a 6 out of 10 pain. And now you can go 80 degrees and you have a 6 out of 10 pain. So yes, your neck still hurts, but you gain 20 degrees of mobility. And you might tell that to the patient, but all they know is my neck still hurts. So that's great to just monitor the progress, but definitely, we want to address the pain in and of itself. And bring the pain down for sure is always the goal. But if you can measure those kinds of things, perhaps it's range of motion, perhaps it's now I can work for 3 hours and my neck doesn't hurt instead of an hour. So that's a measurable change. Maybe now I'm taking a decompression break every 30 minutes. You know, that's a huge thing, because that's going to offset how this person is doing in 6 months and in a year. And sometimes, you know, we want this immediate response, but if we can ensure them that they're offsetting the permanent changes to their spine, their permanent changes to their disc height, their disc health, you know, all these things that are concerns. I mean, I see a lot of people in their 20s who are very concerned about that. You know, one person in particular comes to mind. He's works online and he's an online student. So after work, he goes to school online. And I mean, for him, his schedule is about maybe 16 hours on the computer. So that's the highest number I have right now. And, but those are the people I think who tend to get very concerned about how they're going to be doing in a year, because they're suffering right now and they don't see any end in sight. And so you are their shining light of a way to get over this problem. I mean, really fully get over this. And if I truly believe that the person can really 100% fully get over this, I'll tell them that. And I'll say, you know, I think you can get over this 100%. I don't know how long it's going to take, but my best guess based on this visit number 1, based on, and then I'll give them a list of things. I'll tell them, you know, based on, you know, how long you need to be at the computer. You're able to currently reverse your position. You're not stuck. I see a lot of people who are stuck, and you're not stuck. So you have a lot of really great things going for you. You're eating well. You're not overweight, perhaps. Maybe they are, maybe they're not. So whatever those factors are, they're engaged in what you have to say. So whatever you say is really important, especially on visit 1 and going forward, of course, but especially on visit 1, because that's when you make your case of why they need to come back. So if you can take those measurements and show them their level of improvement, maybe not at every visit, but maybe a month into it, oh, you know what, let's take this measurement again. And that's typically what I do. And look at everybody every month, perhaps, and just measure things and how are they doing in regard to pain level, range of motion. I don't really bring up so much because people don't generally care unless it's something like I can't turn my head when I'm driving, things like that. But if it doesn't really relate to their problem, I'll measure it for myself, but I don't generally bring it up. All they want to do is get rid of their pain. Endurance, as we mentioned, I will usually build up endurance because that's generally what they're having to do for their work. If they're having to sit, you know, 4 to 12 hours a day, then I definitely want to address the endurance issue because they're already having neck pain at hour number 1 of their workday. So I want to build up endurance first, because if we do a resistance exercise, let's say we do something like a 5-pound weightlifting exercise, they're doing 10 to 20 reps, it's over in 1 or 2 minutes. And that doesn't necessarily give them endurance. So I want to build up from, say, 10 reps all the way up into maybe 50, even 100, because then they're building up their endurance. Maybe they do that on their weekends. Maybe they do that on their time off, maybe after work. And so gradually they'll build up the endurance in those muscles so that they don't fatigue so quickly. And then the long-term program, when they are feeling significantly better, at least 50% better, then we'll start getting into more detail about some of these things. I'll give them more strengthening exercises, more flexibility exercises. We'll go into more detail of the ergonomics, posture, diet, stress, and sleep. So all of those things I think are equally important, but I always want the patient to feel like we're addressing their problem. And typically if it's pain, then I want them to experience that we are hearing that they're having the neck issue or the shoulder issue or whatever their pain is, the headaches. Maybe they're still getting headaches, but not as often. So that's definitely something to bring up to them. You know, you were getting a headache almost every day, and now you're having 2 or 3 a week. So that's definitely something to bring up to measure their level of improvement. And here's the CEU coming up on February 6th. So we'll be going into a lot more detail as far as exercises go, really specific exercises. By now, you probably have grasped my style. I tend to give people very few things to work on. We'll go into a lot of details in regard to exercises, but the way it's taught, I think, is really important in that I'd rather spend time on the details because then you get really good at it and you get really confident in teaching them. I see a lot of common errors with things like dumbbell rowing kind of movements where people are compensating with the upper trapezius. It's a great exercise if it's done correctly. Same thing with abdominal exercises. There's a lot of details that come into play with what I call and what is called neuromuscular re-education. So retraining these muscles, because most of our patients, many of them exercise, but they're still having neck pain. So we want to make sure that they're doing these exercises correctly. So we'll talk about ways to recognize those common mistakes and make sure that they're not compensating when they're doing those exercises. We'll go into more detail with the ergonomics and a lot more detail with some of the things that we talked about today. So now we can get into questions. Thank you so much for all of your attention and really appreciate your interest in being here today. And if you register before the 21st, you get the early bird discount. I'll send you a free foam roller and an exercise band as well. So I hope to see you there.
Well, thank you so much. That was such an amazing webinar, and I know everybody really enjoyed it. We do have some questions, so if people wanted to hang and hear the answers, let's get into it. Do you have a chair that you recommend for people who sit at a computer all day?
That's a great question. I get that question a lot, and generally, no.
Oh.
Look for
just bear with us 1 second. Of course, just as soon as we got into the question, looks like her screen has frozen. So just bear with us 1 moment here. Sorry for the technical difficulties. Just bear with us 1 moment here. Okay. Here we go. Sorry about that. Just 1 second. So she's getting ready. Okay, so worst case scenario, if we can't get Dr. Lund back on, what I can do is I can send her the questions, and then we can email them out to the group afterwards. So I do apologize, but let's just give her maybe 1 more second and see if we can get her back in. And if not, again, we'll go ahead and we'll email all of those answers to the questions back out to the group. I do apologize, and I thank everybody for hanging with us through the technical difficulties. Luckily, it was now and not, a half hour ago. Alrighty. Sorry, just bear with me 1 second. Alrighty, so I think what we're going to have to do is, because of the technical difficulties, we're going to end the webinar here. And then what we'll do is we'll ask Dr. Lund to answer the questions offline, and we'll email those out to the group. So I really do want to thank you for everything tonight. I want to thank you guys for attending. I want to thank you guys for all of your participation. I do apologize for the technical difficulties. I would like to mention that we do have a few upcoming webinars. On February 4th, we'll be hosting Dr. Michael Corradino for a sneak peek into the 2021 Neuroacupuncture Conference. And we'll also be on February the 23rd, we'll be hosting tips and tricks for treating knee osteoarthritis. So visit the Lhasa OMS blog for registration for both of those events. And please check your email for the link to Dr. Lund's upcoming class. And I hope you all have a wonderful evening.